up everyone? My name is Morgan Lee and welcome back to my channel. So this week is an exciting week because I am doing something special that is very near and dear to my heart. So if you do not know, December 1st through December 7th is Crohn's and Colitis Awareness Week. And if you don't know, I have Crohn's disease. This December is my 11th anniversary of when I was diagnosed with Crohn's disease. And I really wanted to use my growing platform to talk about inflammatory bowel disease and bring awareness. I'm doing a video every single day to give you more in-depth about what Crohn's and colitis is, how you can get involved with research and fundraising and help that we can one day find a cure for inflammatory bowel disease, and just all kinds of fun stuff. Well, I think it's fun. I'm hoping that this series will be interesting, entertaining, and informative, and that you will want to get involved and help out, and that you'll learn something about me. All right, so without further ado, let's go ahead and get on into the video. Just wanted to give a quick disclaimer that I am not a medical professional. I am just a patient who has Crohn's disease, and I am just sharing my knowledge and information as I understand it. I apologize in advance if I say something that is slightly wrong, but I have done my research and I will link everything that I have down below so that you can further your own research, but I just wanted to make sure that I put that out there that I am not a medical professional. Inflammatory bowel disease is like the umbrella that ulcerative colitis and Crohn's disease fits under. Hey, Editing Morgan here. I just wanted to pop in and clarify something. I forgot to mention that the main thing that is going on with inflammatory bowel disease is inflammation. So the inflammation in your gut, whether it's Crohn's disease where the inflammation can happen between your mouth and anus, or if you have ulcerative colitis where the inflammation is in your colon. So I just wanted to make that distinction. So that's how some people can get IBD confused with IBS. With IBS, there's not inflammation. With IBD, there is, and that inflammation causes damage both to the GI tract, and it can also cause extraintestinal manifestations. Also with Crohn's and ulcerative colitis, you have indeterminate colitis, which is where they can't really tell if you have Crohn's disease or colitis, but you do have inflammatory bowel disease. If you hear IBD, that's just the umbrella term, and Crohn's and colitis are specific diseases. So up first, we have Crohn's disease, which I know more about because I have Crohn's disease. The simple difference between Crohn's disease and ulcerative colitis is that Crohn's disease affects everywhere in the digestive tract, from the mouth all the way down to the anus. So that includes everything in between. And that is not to say that your Crohn's disease would affect every part at the same time. It totally could, or it could be isolated in different areas or spread to different areas upon progression. Ulcerative colitis, on the other hand, is limited to the colon itself. So that is the main difference between ulcerative colitis and Crohn's disease. So first, I just wanted to highlight a few symptoms that can come with inflammatory bowel disease. As you can see on the screen, there is a very long list of things, and I'm not even sure if I included everything, but I just want to talk about a few of them that were very significant for me, such as abdominal pain, unexplained weight loss, fever, fatigue, bloody stools. Those were some of the big key symptoms that led me to knowing that something was wrong. The next thing that I would like to talk about are the risks and complications of inflammatory bowel disease. So the first and probably the most prominent one is the increased risk for colon cancer, as well as medication side effects such as drug-induced lupus, osteoporosis, osteopenia, and increased risk for infection with drugs and treatments that modify and suppress the immune system. Next, I want to talk about the different methods that solidify a Crohn's or colitis diagnosis, and that includes things like MRIs, colonoscopies, upper endoscopies, sigmoidoscopies, a lot of oscopies, as well as blood work and in some cases stool samples and things like that. Next, I would like to highlight treatment. The treatments for Crohn's disease include immunomodulators, steroids, biologics, which are usually given intravenously or through sub-Q injection that help to suppress the immune system to stop it from attacking the gut and reduce inflammation. And the last one being surgery. So some people think that surgery is a cure for IBD, but it is not. Surgery usually results in an ostomy or colostomy bag. There are other terms that I'm not aware of that I will not try to elaborate on, but there are many different surgical procedures that help aid Crohn's or colitis, but does not cure it. So those are different types of treatment options. I hope that this video was very informative for you. Let me know down in the comments what you thought. If you have any other questions, we are doing a Q&A at the end of the week. So if you have any questions that I did not answer or that don't get answered this week, please be sure to leave those in the comments below, and then we will make sure that we get to them when we do our Q&A. Again, thank you so much for watching. We will see you tomorrow with another video for Crohn's and Colitis Awareness Week. Give a like, comment down below, subscribe if you're not subscribed, and we'll see you tomorrow.